Hello everyone, myself Shravani and welcome to my page Shraayur. In this video, we are going to talk about ADHD from an Ayurvedic perspective. Now, what do you mean by ADHD? ADHD is considered to be a behavioral disorder standing for Attention Deficit Hyperactivity Disorder. Okay, so we will start learning about it according to the Ayurvedic perspective. So in Ayurveda, ADHD is not a single named disease, but it can be understood through vata imbalance, especially through prana vayu affecting the mind and the cognitive faculties. So you have to keep in mind that it is a vata centric disorder. Introduction. So ADHD traits often reflects an imbalance of vata in which prana vayu plays an important role, and it is going to affect your manas as well as your majja dhatu. So Ayurvedic approach frames as symptoms to stabilize the nervous system overstimulation. So ADHD, there is overstimulation of the nervous system. So the main focus is to stabilize the vata, hence decreasing the overstimulation. We also have to restore the rhythmic grounding, that is the rhythmic functions of vata, and decrease the overstimulation through diet, routine and supportive therapies. So how do you diagnose it? So vata features mainly are restlessness, racing thoughts, distractibility, irregular sleep and sensory overload. Sensory overload means you're overthinking, performing things, over doubting yourself, okay, and also there is hyperactivity present. So clinical focus is to calm the nervous system. Then, as you know, according to Ayurveda, whenever there is excessive amount of activity, or you can say when there is excessive amount of vata, it is always linked to raja, which is considered to be one of the dosha of your mana. Okay, raja and tama are two dosh in which raja is going to affect in ADHD. And you also have to reinforce the attention because a person cannot concentrate well enough in this particular disorder. We have to reinforce the attention through consistent rhythms and nourishing patterns. How does the Ayurvedic pathophysiology work? So primarily dosha involved is vata, which is especially a prana vayu, and the associated dosha is the rajasiddhi, which is mental hyperactivity. Okay, the dhatu involvement which is present is your majja dhatu, as we discussed earlier. The strotas affected are the manovaha strotas, resulting into instability, hyperactivity, poor focus and impulsivity. So if we go towards the symptom mapping, correlating the Ayurvedic as well as the modern perspective, we can see that vata buddhi leading to chanchalta, that is restlessness of your mind. Hyperactivity is occurring because of the raja dominance, and pranavata aggregation, which is going to lead to impulsivity or your weak buddhi or dhruti. Dhruti means your control and buddhi means your intellect. Poor memory, termed as smriti bhransha, due to the vata imbalance. So what are the causes? Main causes include your irregular routine, irregular sleep cycle or irregular food timings, okay, excessive screen stimulation, dry cold junk food, stress, anxiety early in your life, or lack of grounding activities. Triggers also include your irregular routines, skipped meals, excessive screen time, cold dry foods, caffeine, very important, and sleep deprivation, which is the most common thing in youth these days. Addressing these all, it reduces the vata provocation and it supports the lasting symptom improvement. How do Manas and Majja work? Manas is your mind and Majja Dhatu is considered, not completely, but you can correlate it with nervous tissue for a better understanding. So these two govern the cognition, memory as well as the neural regulation. Okay, so symptoms like distractibility and restlessness are going to reflect the instability which is seen in your nervous system, and therefore it is going to disrupt your mental rhythm, because of which you cannot focus or concentrate easily. What is the management strategies or management principles, also termed as Chikitsa Siddhanta? So first of all, you have to focus on Vata Shaman. Okay, so it is going to be a key focus. For that, dietary measures which we can follow is you can emphasize on the warm, nourishing meals with healthy fats. Healthy fat means exactly ghee. More specific, cow ghee. Okay, cooked grains. Cooked grains are always going to ground vata. That means they are going to decrease the vata. Okay, so you have to consume warm, nourishing food, and you have to include it in your daily routine at particular timing. You have to have your food at fixed timing. Okay, you have to prioritize your regular meals, include ghee, then you have to include soaked nuts to increase the snigdhata in your body, warm spice milk to decrease the shitata of vayu. You have to avoid cold, dry and heavily processed foods, which also includes cheese, by the way. Lifestyle routine is again very important. You have to establish a consistent sleep-wake cycle. Okay, you have to put your life in a particular rhythm. Okay, you have to start with your predictable daily rituals to reduce the vata fluctuation. You have to incorporate grounding movements. You have to perform oil massage, abhyanga, and you have to reduce the screen exposure to support its regulation. Whose regulation? The pranavayu's regulation. Okay. So next important thing is the herbal support. In this you have to consume Medhya to increase your cognition. Okay, so these are Medhya Rasayan means your cognitive enhancers. These are the herbs that are going to improve your intellect and memory. So Brahmi is very important in improving the focus as well as the memory. Ashwagandha, it is going to reduce your hyperactivity and it is going to calm your mind. Sankha Pushpi, it enhances your concentration. And Jatamansi, it stabilizes emotional imbalance. Okay, all these drugs are required to enhance the memory as well as to calm the mind. But be clear that herbal prescriptions should be always personalized according to the prakriti of a person, age, digestive strength. Therefore, you have to consume it under professional guidance. Most important clinical note is ADHD is a modern diagnosis. It is not an exact Ayurvedic disorder. We are just comparing it and we are learning it from an Ayurvedic perspective to keep our mind at ease and to just try and see how Ayurvedic medicines work. Ayurveda is going to provide a functional and holistic management. It is not a direct cure. Severe cases, if you are dealing with severe cases, you may need an integrative approach. That is, you have to consult an allopathic physician as well as an Ayurvedic physician. Okay, if you are facing this problem since a very very long time, even though you are consuming medicines, if you are not finding any difference, you definitely try this Ayurvedic management. This will definitely help you. Thank you. Stay tuned to the next video and don't forget to like, share and subscribe.